Assalamualaikum dan salam sejahtera. My name is Mazriyana binti Mat Kasim. Today, I would like to present my research paper with the title Compassion Fatigue and Compassion Satisfaction Among Critical Care Nurses. Before we proceed, this is my content outline for this presentation. As introduction, critical care nurses provide specialized nursing care to critically ill patients who require careful assessment as they are in critical. This situation may become a source of stress as they have to witness the patient suffering and dying. Due to the nature of the working, the critical care nurses are at high risk to experience compassion fatigue, which is exhaustion of emotional, physical, social, and spiritual. Compassion fatigue contains two elements, which are burnout and secondary traumatic stress. Compassion fatigue is giving an impact to the nurses, professions, and the organization in terms of safety, quality, and patient satisfaction. These negative elements in compassion fatigue will be balanced with the compassion satisfaction as the positive coping mechanism. Nurses should understand and recognize the sign and symptom of compassion fatigue in order for them to look for the support when they are at risk. Having an understanding on the issue, the organization should be able to develop an intervention program in handling compassion fatigue, so nurses can continue to provide compassion care for the patients. Longer exposure to the trauma of patient, death, grief of patients and family, the critical care nurses are at a high risk to experience compassion fatigue. This situation can affect the nurses' profession, safety of patient, quality of care, and may lead to patient dissatisfaction. Prolonged current situation may cause the nurses to have poor nursing performance and judgment leading to the medical error, less empathy and compassion, increase in sick leave, moral distress, increase in the absenteeism and staff turnover. As a result, the nurses have to leave the profession due to the job dissatisfaction and spiritual emptiness, and leading to the shortage of the nurses in the country. In view of that, it is motivated for me to identify the level of compassion fatigue and compassion satisfaction among critical care nurses. Compassion fatigue is described as exhaustion of emotional, physical, social, and spiritual characteristics as direct result and prolonged exposure to another person's trauma or difficult situation. Compassion fatigue contains of two elements, which is burnout, as described as progressive loss of idealism, energy, and goal as the result of personal or occupational stress. The person with the burnout loses their work interest, experiences exhaustion, and the physical and emotional breakdown due to the high level of stress over time. Another elements of compassion fatigue is the secondary traumatic stress. It is the phenomenon where the individual becomes traumatized not by directly experiencing a traumatic event, but by hearing about the traumatic event experienced by someone else. Previous study has been done to measure to identify the compassion fatigue and compassion satisfaction in the nursing. Study by the Mayer et al. 2015 mentioned that descriptive longitudinal study to the 251 pediatric novice nurses working in the children's hospital showed that after 3 months of witnessing stressful events during their duty, they experienced high level of compassion fatigue and the burnout. And according to the Donna and Amy 2016, the nurses who completed the survey showed average to high level of compassion satisfaction and average to low level of compassion fatigue. These findings are reflective of a positive work environment. There is a significant relationship between working unit with the confession fatigue and confession satisfaction by study of Molly et al. 2015. The nurses in the neonatal intensive care unit described their feeling of frustration and hopelessness, which contribute to the moral distress, especially if involved in resuscitation of extremely premature infant. Therefore, if the situation continue, it may lead to the confession fatigue. According to the Branch 2015 descriptive cross-sectional study to identify the prevalence of confession fatigue among 296 pediatric healthcare providers found that pediatric ICU nurses are having high burnout and secondary traumatic stress with a low confession satisfaction, whereas staff in the cardiology unit score higher in confession satisfaction. Seco et al. 2015 conducted a cross-sectional study for the 221 nurses from the 9 critical unit at academic medical center found that nurses who are solely caring for the ICU patient experience high level of confession satisfaction compared to the nurses working in the unit with a mixed type of patients. And Beck et al. 2017 demonstrated from the 175 nurses of neonatal intensive care unit, 49% of them had moderate to severe secondary traumatic stress due to the caring critically ill infant. This study was conducted at intensive care unit, cardiac care unit, pediatric intensive care unit, and neonatal intensive care unit of Hospital Raja Kumaisuri Bainun Ipoh Perak. A total of 117 questionnaires were distributed. However, only 106 or 91% were completed and taken for analysis. The Pro Quality of Life version 5 developed by STEM 2010 was adapted and it is widely used to measure the confession fatigue and confession satisfaction among healthcare professionals in specialty settings such as critical care unit. The Pro Quality of Life survey consists of 3 subscales, which are burnout, secondary traumatic stress, and confession satisfaction. Out of the 3 subscales, burnout and secondary traumatic stress are components of confession fatigue, and confession satisfaction is 10 alone. Each subscale consists of 10 items rated using the 5-point Likert scale. The finding of this study showed that majority of the participants aged 30 to 39 years old and most of them are married. Majority of them are working in ICU and was the large responder in this study. Most of them are diploma level and some of them are having post basic. About 39.7% of respondents are having 10 to 12 years experience working in critical care. In this study, I found that generally the participant in this study score average on confession satisfaction, burnout, and and secondary traumatic stress. The result indicates that from 106 participants, 22.6% of the participants experienced low burnout, 48.1% had moderate, and 29.2% had high risk of burnout. For the secondary traumatic stress, 24.5% participants experienced low, 60.4% had moderate, and 15.1% had high risk of secondary traumatic stress. For the confession satisfaction, 25.5% of them had low, 50.9% had moderate, and 23.6% had high confession satisfaction. Majority of critical care nurses in 4 units of critical care score within the moderate level for all the three subscale. Even though not statistically significant, descriptive comparison for the level of compassion satisfaction among units show that pediatric ICU had low compassion satisfaction compared to the other unit, and coronary care unit had the highest compassion satisfaction. For the burnout scale, neonatal ICU had a low burnout compared to other unit, and PICS ICU had a high burnout compared to the other unit. For the secondary traumatic stress scale, neonatal ICU had low and pediatric ICU had high secondary traumatic stress. Significant in the confession satisfaction and confession fatigue. This study find out that there is a significant difference in the secondary traumatic stress score within the work unit. Post hoc comparison revealed that PICS pediatric ICU was significantly different from the coronary care unit. This result showed that 20.8% of the nurses working in the pediatric ICU had high secondary traumatic stress compared to those who work in other units. A one-way ANOVA also was used to assess burnout then compassion satisfaction within work unit, and found that there is no significant difference among units of critical care. For the level of compassion satisfaction, generally, the nurses in this study score moderate range for all the three subscale of compassion satisfaction, burnout, and secondary traumatic stress. This finding was relatively similar to the study by Marwa et al. 2018 in Jordan. The result demonstrated that most of the nurses had low to average of compassion satisfaction. Different results were revealed from the study by Donna and Amy 2016 in critical care nurses and adult community ICU in southern New Jersey. The result indicates average to high level of compassion satisfaction. A possible explanation is that positive working environments such as continuous monitoring by the superior, having good cooperation among colleagues, and having opportunity for personal development may cause the nurses to work happily, leading them to have moderate to high level of compassion satisfaction. For the level of compassion fatigue, most of the nurses are having moderate to high score of burnout and moderate to low score of secondary traumatic stress in their workplace. This result was similar with the study by Baker et al. 2015 and Bao and Taliaferro 2015, which they found that their participants score low burnout, moderate burnout, and high burnout. The current result contradict with the study by the Sadigeh, Vahid, Azad, Marian, and Hossein 2020, where the Iranian critical care nurses obtained high level of compassion fatigue, with the majority of the nurses scoring in the average or higher level of burnout and secondary traumatic stress. The high prevalence of the compassion fatigue that could be dependent on the workplace characteristic of culture or the culture. The level of confession fatigue and confession satisfaction among work unit of critical care. The descriptive analysis showed that the level of confession satisfaction among work unit is moderate, with those in the pediatric ICU having low confession satisfaction compared to the other unit. Coronary care unit has the highest confession satisfaction, but no significant difference found between the work unit. The level of burnout among the work unit is moderate. Neonatal ICU having low burnout, and PICS ICU had a high burnout compared to other units, but no significant difference found between the work unit. This result is similar to the study done by Berger et al. 2015, where the nurses in all pediatric working units score moderate burnout. However, there was a significant difference found between work unit where nurses who work in pediatric medical and surgical unit had high level of burnout compared to the other pediatric units. It could be it could be due to the nurses in the study was frequently exposed to traumatic events such as child abuse, sudden or anticipated death, and excessive workload due to the shortage of staff and large number of the new nurses. For the secondary traumatic stress scale, the descriptive analysis in this study showed that the level of secondary traumatic stress among working unit is at moderate level, but ANOVA tests show that there is a significant group difference in mean of secondary traumatic stress in which 20.8% of the nurses working in pediatric ICU have high secondary traumatic stress compared to those who work in others unit. Possible explanation of this finding is that the nurses in the pediatric ICU are always dealing with the critically ill children on a daily basis, involved in the assisting painful procedure and dealing with the death of the child and grieving of the family. This result is similar to those reported by SECO et al. 2015, where the nurses working in single unit of ICU, such as adult ICU and pediatric ICU, had significant high level of secondary traumatic stress, even though burnout score did not show significant differences. Understanding the level of burnout, secondary traumatic stress, and compassion satisfaction can help the nursing manager to work together with their nurses in handling the symptom, and this indirectly will improve group performance. Poor leadership skills such as ignoring and not listening to the staff work problem cause the nurses dissatisfaction. Positive working environments such as good leadership skill and nurse manager or superior support are very important for nurses satisfaction, especially among critical care nurses. As conclusion, overall the result revealed that the critical care nurses score moderate level of confession fatigue and confession satisfaction. Nurses should be aware on how to prevent and cope with the symptom of confession fatigue. It is important for the nursing manager and counseling unit to play a role in reducing the effect of burnout and secondary traumatic stress among nurses as the healthcare professionals who are at high risk of confession fatigue. Through the resiliency program in confession fatigue prevention, it is hoped will increase the quality of nurses in healthcare setting and at the same time will improve nurses' retention and satisfaction. That's all about my presentation and thank you very much.